are here now with Dr. Gerald Zelenock of the UT Medical Center, and he is the professor and chairman of surgery. And we're talking about, first of all, something we hear very little about anymore, and that's exploratory surgery. Why don't we hear about that anymore?
It has all but disappeared in clinical practice. The imaging that we're able to get with advanced CAT scans, MR scans, PET scanners is so extraordinary that we know precisely where we're going and what we're going after in the vast majority of cases. So exploratory surgery is clearly a thing of the past.
And that's because of imaging, and also when you do the surgeries, once you diagnose something, you have amazing technology to make incisions much smaller.
There's a trend within all of surgery in every discipline to use minimally invasive surgery, and this enables the surgeon, instead of making a long 1.5 or 2 foot long incision in the abdomen, to go in through little tiny incisions with a laparoscope or with robotic surgery or endovascular surgery where they go through the blood vessels. It's much safer, it's much less stressful for the patient, and frankly they do much, much better with rapid recoveries and home to their families very quickly.
Now, even for things like gallbladder surgery that used to be a fairly big incision?
That's exactly right, Laura. We have patients who have a single incision in the belly button. It's called SILS, S-I-L-S, single incision laparoscopic surgery. A little teeny half-inch incision in the belly button, and the gallbladder can be removed with no other incisions. The patients are home either the same day or at the latest the next day, and they tend to do extremely well with this type of procedure.
Now, you all are at the cutting edge of much of this, doing things, while they're still fairly new. Would people find these sorts of procedures at all hospitals, or do you have to really look at what hospital you go to for a surgery like this?
I think you do have to always look at which hospital you go to. The advances in communication technology enable findings and discoveries from the medical centers to go almost immediately to the community. So there's a very rapid transfer of information, but I think it's always very important to pay attention to which hospital you go to.
Okay. Now, recovery times are something that are certainly affected by this. If you don't have a big incision to heal up, you can get out of the hospital much faster. Can you give us some examples of that?
Sure, I can. In my own field, which is vascular surgery, blood vessel surgery, a common problem is an aortic aneurysm, a weakening of the main blood vessel in the body. In the old days, i.e. 10 to 15 years ago, what we would do is make a very large incision from the breastbone down to the pubic bone, open the patient up and do a procedure. They'd stay in the intensive care unit for 3 days, another 6 to 7 days in the hospital, and frankly would recover over the next 6 months at home to regain their strength and vitality. Now we can go in with a catheter, thread the graft into the right position, deploy the graft, the bypass graft, inside the aneurysm, and they're home in the next day. It's quite remarkable, and these can be extraordinarily sick patients or frail patients who never would have survived an open operation. So their recovery is better, they're on their feet within a day. It's quite remarkable.
So we're talking a week versus a day in some cases?
Every bit of that. It's even better in terms of the long-term recovery, because 6 months out is what you'd have for a recovery from open surgery, whereas within a day or two they're up and about feeling themselves again.
Well, that's exciting. Minimally invasive surgery. Thank you so much for sharing some of it with us, Dr. Zelenock. That is tonight's Talk Back.